Good morning, everyone. I'm Sayukta from Vistas Media, your host for today on Hair All Issues Resolved YouTube channel. We go through a lot of look beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hairs, we have with us an expert dermatologist, Dr. Payal Choksi. She is a dermatologist and cosmetologist in Surat and has an experience of 13 plus years in this field. Dr. Payal Choksi practices at Prasanna Hospital in Surat. She has completed her MBBS from CU Shah Medical College, Surendranagar in 2005 and DDBL from Sardar Patel University, Karamshad in 2009. Dr. Payal expertise in laser surgery, scar treatment, laser hair removal, face, anti-aging treatment, dermabrasion, PRP for hairs. Basically, all cosmetic treatments is her field of expertise. A very warm welcome to you, Dr. Payal Choksi. It's a pleasure to have you with us, ma'am.
Thank you so much for your kind words, and hello, very good morning, everybody. Hello.
Thank you, Doctor. Today we are going to talk about issues related to hair, and all of us at some point of time or the other go through this this phase where we are really concerned for our hairs. So today we'll start with the hair fall thing. Now the thing is, every day all of us do lose some amount of hairs, but we are not aware when we should be concerned about the hair fall. I mean, how much hair shedding is considered normal and when we should be concerned about it or contact a dermatologist like you about it. Please shed some light over it.
Hello. See, first of all, we should know what is the basic hair cycle. Hair is having two cycles. One is the growing and a second is the resting and the shedding phase, right? So in our life, in every year, we are having a shading of our hair, which is hairs, which are considered as a normal. See, falling of hair depends on the person to person. For someone, it is 10 to 20 are normal. 30 to 50 are normal. For the someone, it is 60 to 70 are also considered as a normal, as a daily hair fall, right?
Okay,
and for some people, they are considered as a excessive falling of the hair, right? So depend on the person to person, it may varies. According to the books and the scientifically researched data, it is written that from 100 to 150 hairs per day, shedding of hair is considered as a normal. But it is not like that every year it is falling and it is considered as a normal. It falls and it comes to its growing phase. So again, new hair are coming. It is like that, right? And it is not daily that 100 hair are. Sometimes you may have 10 to 15 hairs per day. Sometimes you may feel 50, 60 or 100 when you wash your hair. So it depends on the day to day, about the season to season. And if you are having any medical condition, any other problem. So it depends in so many factors, right? But whenever patient is feeling this is not normal for me, they should go for the concerned dermatologist. Along with falling of hair, they are feeling that their ponytail is also becoming thin. They are having sparsity on the scalp, their hair thickness is decreasing, or the other symptoms which they are not aware of the daily routine. They should consult the dermatologist and get checked.
Right. So whenever we see something which is not normal or which is not, what was happening to us on a regular basis, we should get concerned and consult a dermatologist. Now, we'll also, through this session, like to understand that why it's important to immediately go and consult an expert, a dermatologist in this case, and not waste our times in, home remedies or over-the-counter medication or nutrient supplements, etc. So we'll also talk about it. But right now, we would also like to understand, doctor, why we shed hairs, or what are the major causes of hair loss?
See, as such, there are list of causes, but coming to the main important one is the nutrition nowadays. Because now the habits of the eating is changed. People are eating most of the junk foods, outside foods, and some are becoming obese, so they are doing dieting. So many diet plans are also available in the markets, right?
Right.
So nutrition impairment leads to hair fall, right? Hair is a vital organ of our body. It needs proper nutrition in the term of macro and the micronutrients, like the balanced diet, which is rich in carbohydrate, protein, fats, minerals, essential amino acid, fatty acids, right? So if we are lacking, our body is getting insulted, and after 2 to 3 months of this, we start shedding of our hair. Another is the if we are having any hormonal problem, right? Like in the female, if they are having PCOD, excessive hair fall, along with the unusual hair on the face, like on the chin, on the upper lips area, or on the body part where it should not be, right? And obesity, they are having again hypothyroidism, than the androgens. Now, nowadays, the male patient and the female patient, you will see they are having the frontal baldness or the temporal baldness. So the excessive androgen also play the role in the hair fall. Genetic history in your family, if your father or mother is having the baldness, kids are likely to get baldness, right? And there are certain drugs which can lead to hair fall, like antipsychotic drug, chemotherapy. If patient is on chemotherapy, if they are having any problem and is taking this kind of drugs, then there are chances of falling of hair. Nowadays, in the COVID scenario, we have seen so many cases of hair fall in this pandemic area, right? After COVID, after typhoid, dengue, malaria, these are the common viruses and the bacterial infection which may get the stress. Our body gets stressed when we are infected, and after 2 to 3 years, we get the history of the hair fall.
So there are, as you said, a number of causes responsible for hair loss, but then you also discuss about the major causes. Now, as you said, diet or nutrient plays a very important role. Now, the thing is, you also mentioned it while you were elaborating the thing that many a times, because people these days are very concerned about their frame, how they look, I won't say that they are very concerned about their fitness, because in fitness, diet plays a very important role, but they are very concerned about their frame. They feel that I should, fit into certain frame of body. And for that, they'll either eliminate or omit carbs from their diet completely, or they'll go on some diet, some crash diet, or fasting. People are fasting for like 16 hours a day and eating for just 8 hours. And I would like to understand, doctor, and our viewers, I'm sure, would also like to know how good or bad these practices can be specifically for our hair.
You are asking about fasting, right?
Yes, fasting, crash dieting that people are these days going for.
Basically, I would suggest and I would tell that why should we keep in a position when we have to do fasting? When we feel we are increasing, and this is the alarming thing that our weight is increasing, we should stop and we should take care at that time. What people does, they just keep on adding their weight, and then at a time they feel that now we have to lose the weight because we are not fitting, our clothes are not fitting, right? So first of all, we should come in that scenario. If you're having underlying problem, like without eating much, like hypothyroid problem, you may get, or any cortisol problem, you may gain weight irrespective of your diet. In that case, scenario is different. But I would prefer that from the beginning, you should take the proper healthy lifestyle, eat proper balanced diet. In fasting, what people doing, they are not taking proper amount of food. They are deprived of carbs. They are taking some or another way the nutrient, and without consulting any dermatologist, any dietitian. इसने किया है तो अच्छा weight loss हुआ है, इसने किया तो हो गया, and they are just doing by themselves. They are not guiding, under guidance they are doing. So at all you have a problem of overweight and you want to do fasting, first of all you should consult proper dietitian, proper dermatologist कि हमको अभी weight कम करना है, तो which nutrition are important for the body, and according to you have to make a chart and do fasting. तो शुरुआत में आपके बाल गिरेंगे, दैट इज नॉर्मल, क्योंकि बॉडी में जब जब इंसल्ट होता है तो बाल गिरते हैं, स्किन में इफेक्ट आता है, बिकॉज हेयर एंड स्किन आर द मिरर ऑफ योर हेल्दी लिविंग स्टाइल, राइट? But if you have done it in a proper way with good number of exercise, not alone only on the diet plan, then definitely your shading hair will come into the growing phase. So you won't feel on the longer period of time thinning of your ponytail.
Right. You also very well, pointed out that we are lacking on certain nutrients, macronutrients, micronutrients, and people, have this notion in their mind if they are shedding hair, which is not normal, they'll immediately go to a chemist and say, "Oh, मुझे बायोटीन डेफिशिएंसी हो रहा है, बाल झड़ रहे हैं, तो बायोटीन सप्लीमेंट दे दो या जिंक दे दो या मे बी आई एम आयरन डेफिशिएंट और इसलिए मेरे बाल झड़ रहे हैं, तो आयरन supplement दे दो." They won't even go consult a dermatologist. They won't even go and consult their own family doctors and see whether I'm, deficient on something or not. They'll just go because they know that these things are associated with good hair health. So they'll immediately go buy these supplements and start popping them. How good or bad this kind of practices can be.
This is not at all good practice to go to chemist whenever you are having qualified dermatologists. In each and every cities and in fact in the village also you are having, right? The better you should take a guidance from them, take their services, go them and consult them, because there are so many nutrients which are necessary for the hair growth and the hair shading, right? Which kind of nutrient you are deficient that you cannot know. With a proper history and examination, doctor can see that. If you are anemic, if you are pale in the Indian scenario, female are mostly anemic. So we provide them iron tablets, containing iron more. Some patients are hypoproteinemia. So we give them protein intake. We advise them. If you are having hypothyroidism, so along with the proper history and the investigation, only hair fall treatment is not going to work out in that case. So we have to give the thyroid supplements also, right? If you are having PCOD, so we have to take care of the sonography, proper hormonal imbalance, the result, and then we can give. So there are different types of problem which can lead to hair fall problem. So some are having some patient comes to my clinic with a joint pain, a leg ache, and they are working in a IT profession. So 24, it means almost 12 to 15 hours in a day in the room only. So they are deficient in the vitamin D also. In that case, we provide the vitamin D to them. So we have to take the proper history, and according to we give the different kind of multivitamins to the patient. One is not all for everyone.
Exactly. That is the main thing. We all are different. We as an individual differs from each other. And definitely the cause of whatever is happening to us is also different from the other person. So please don't follow what others are following. Please follow what your doctor is asking you to do. So please go consult a dermatologist, qualified dermatologist, and trust your doctor. That's really important. Now, doctor, moving on, we would also like to know about the medical management available for treating hair loss.
See, for the medical management, again and again, I'm telling you, the first important thing is the history. Whenever patient of the hair fall come to my clinic, it's a mandatory. I have instructed my staff also for at least 10 to 15 minutes, don't allow any other disturbances, because the first history and the counseling is very much important, because the treatment goes for the medically also at least 3 to 4 months. So the confidence between the doctor and patient should be established from the first meeting, because patients are very much impatient. They take one tablet and they will find they want to get a result within a week only. After starting treatment, you won't get improvement within a month. You start showing improvement after 1 to 1.5 months, right? Depending again on the history, we give patient the most FDA approved preparation which is in the market. We are having the minoxidil 2% and the 5%. For the female, we give the 2% minoxidil, and for the male patient, we are giving 5% minoxidil. And along with that, if it is androgenetic alopecia, we give the hormonal treatment also. For the male patient, it is finasteride and the dutasteride, which is recently newer molecule. So it inhibits the and receptor activity of the hormone, and it increases it stimulates the new hair growth. So the patient gives a new therapy, new growth. And along with the nutritional supplements, which kind of patient is we are seeing and examining, and investigate and which kind of nutritional deficiencies patient is having. We do give biotin, but if patient is anemic, then we give the iron preparation tablets also, and the different kind of vitamins we give to patient. Nowadays, the research is for the medical. I am talking. PRP is the very latest treatment which is going on. What we do with the PRP, we inject blood from the patient after doing baseline investigation like the complete blood gram, thyroid, ferritin, total iron binding capacity. We take the blood from the patient and then we centrifuge it and we differentiate the growth factors out of that, and we are going to inject that growth factor on the scalp of the patient. So what they are going to do, they are just going to stimulate the hair fall which are in a dormant follicles. कुछ follicles ऐसे होते हैं कि जो growing phase में चाहते ही नहीं, they are just resting over there. So stimulate the hair and new hair follicles start developing. In a normal layman language, we can see हम पौधा लगाते हैं तो एक पौधे में हमने खाद डाला और एक में नहीं डाला, तो कितना डिफरेंस हमको मिलता है, right? So this is the thing with PRP and without PRP. But it's a combination treatment. Along with PRP, we give the oral and the topical application also.
Okay, so this PRP falls under non-surgical management?
Yeah, as such, it is invasive, but we don't have to, patient don't have to take a rest, or it is totally harmless without side effect treatment.
Okay, because whenever we talk or read about management of hair loss, we are said that there is one medical management which we just now talked about. Then there is one non-surgical and there is surgical. So though we have already talked about the medical management of hair loss and PRP as well, but we would also like you to shed some light over non-surgical management if there is anything else than PRP and the surgical management of hair loss as well.
See, for the non-surgical, apart from PRP, first of all, if patient comes with us in initial phase, where we can see there is a thinning of the hair, but the hair quantity is still there, we will advise patient to go for the medical management. Patient is still not improving. Then along with that, we will combine the PRP, right? But when we do examine the scalp of the patient, if the thinning of the scalp is there and patient is not having much hair on the scalp, in that case, medical treatment is not going to work more, because जब अंदर कुछ follicle active ही नहीं है, तो हम कितना भी डालेंगे वो grown up नहीं होगा, बीज ही नहीं होंगे तो पौधा नहीं उगेगा, ऐसी बात है, ठीक है? In that case, we are doing the different surgical therapy like hair transplantation, and that the different types of hair transplantation are also available. The latest is the follicular unit transplantation. Earlier, we used to do the punch, single or the bipunctual, then scalp reduction type of treatment, but they all were having artificial hair implant also earlier we were doing, but they all are having the major side effects compared to the recent one, which are the follicular unit transplantation. They are having the less side effects. So we are suggesting, and some of the patients, they just don't want to go any kind of surgery. For them, now the microfibers are available in the market, the wigs are available, so, and hair weaving are also available, so they can go for that also.
Yeah, the best part is that there's so much advancement has happened and there's so much available. The only need is to go to the right person, seek advice from a right person, and that's a qualified dermatologist. So again, we are saying the same thing. The bottom line is, please go and consult your doctor if you're seeing that something is not going well with your hair loss. And many a time, doctor, it happens. I mean, there are causes which are responsible for hair loss. For example, you said if I'm not eating well, if I'm not resting well, or I'm in stress, etc., or my hormones are not doing good, then of course I'll have hair loss. But there is another possibility as well, that if my hair's I'm shedding more than normal hair and I go to a dermatologist, they do whatever scans, tests, etc. they do, and then they'll find out that there is actually an underlying medical condition. So is there also probability that by hair, because as you said, hair is actually how healthy we are, it reflects our health parameter in a way. So is it also possible that if we go to the right person at the right time, we'll actually understand our what is going on in our body well in advance, well in time?
See, there are so many underlying medical conditions also which can lead to hair loss. Some of them are the dandruff, which is very much common in all on every having the dandruff. Seborrheic dermatitis, psoriasis, fungal infection of the hair, bacterial infection of the hair. There's an autoimmune diseases also in the hair where patients are shedding hair in a patchy manners. Then the one is the alopecia areata, जिसको patient बोलते हैं in our language, patient are telling it's undri, right? Suddenly, when patient notice that there is a patchy loss of the hair on the scalp, they tell that, madam, we were not aware that when it has gone, or whether our salon has noticed that you are having the patchy loss. So there are so many medical conditions, and we do the trichoscopic examination when we can see the thickness of the hair shaft and the scalp condition also. Yeah, so it's better whenever you are feeling that something is not going right, you should consult your doctor and you should be treated accordingly. Please, please, please don't do by yourself, because you are going to end up with some other problem. We are facing the patient, they are applying so many things on the scalp for the dandruff, like the onion juice, garlic juice, curd, and so not. And finally, they are end up with the skin burn. So we are keeping hair aside and we are treating that skin condition at that time.
Right.
So this happens.
I was coming to that, it's very important to understand. जब हमें किसी और organ में किसी तरह की तकलीफ होती है, मान लीजिए हमें chest में pain हो रहा है, तो we'll go to a cardiologist and consult the doctor, or else cardiologist तक नहीं भी गए हैं तो at least हम अपने family doctor तक तो पहुंचते हैं कि हम क्या करें, फिर वो सही बताते हैं कि कहाँ जाना चाहिए. अगर हमें लग रहा है कि bladder related या urine tract related कोई problem है, तो we'll go and seek the help of a urologist. वहां नहीं बात बन रही है तो उन्होंने फिर nephrologist को भेजा. इस तरह से चीजें आगे बढ़ती हैं, लेकिन हम डॉक्टर को जरूर दिखाते हैं दूसरे organs के केस में. But when it comes to our skin, the doctor is our last resort. First thing we'll do is to go run inside the kitchen, do some home remedy, or else we'll go to the chemist and find a quick fix कि कोई ऐसी दवाई दे दो बाल झड़ना बंद हो जाए, scalp की problem खत्म हो जाए, dandruff खत्म हो जाए, or we'll seek advice from a family or friend who has gone through the same problem. The doctor is our last resort because we take our skin or our scalp or our hair so we are maybe not very serious about it. But the thing is that actually, determines the whole appearance, the whole look. And again, हेयर लॉस के केस में हम बार बार कह रहे हैं कि हो सकता है ये किसी और वजह से हो रहा हो, और वो भी फाइंड आउट करना बहुत जरूरी है. मे बी यू आर deficient on certain nutrients or vitamins, etc. So it's very important to understand why your skin or scalp or hair is not in a healthy way, and for that you need to go and consult a doctor is the bottom line. Doctor, one more thing, because you just talked about dandruff a bit. Now, dandruff again is very common with people, especially in India. Now, we would also like to understand, does dandruff cause hair fall? What are the main causes of dandruff? Or हमारी society में culture है, we'll have dandruff, we'll put more oil on our hair, scalp, feeling that they are the skin is getting dry and we need to just put some oil to soothe the skin. So how these practices are for treating dandruff, please elaborate.
See, generally dandruff, it is mainly happen due to the malacia. It's one kind of fungi that it's a normal inhabitant of our body. You and me and all our viewers, we all are having the malacia. But when the susceptibility to this malacia has increased, or when the growth of this malacia fungi is increased in our scalp, we end up with the dandruff. Generally, the shading of the scalp skin are attached to the hair, and we can see the dead cells are attached to the hair shaft, light fine scales. This is considered as a normal. But whenever you scratch your hairs and you feel that snowflakes, like the coat on what kind of coat I am wearing, we can see the white flags on my scalp or the itching. It is considered that it's an alarm that you should go to your doctor, right? There are so many causes of the dandruff. One, I have mentioned malacia. Second, the overproduction of the sebum because of the hormones. Generally, dandruff starts from the puberty up to the 5th or 6th decades of your life, and then finally it vanishes off by itself, right? So during this period, we are having the hormonal overproduction, right? So over sebum production or the overproduction of the oil from the oily glands leads to dandruff. Then normally the hair cycle is 15 to 30 days. Dead cells removal, right? But when it is decreased from 4 to 10 days, then we feel that so many dead cells are there on the scalp. So there is a dandruff. Another is the immunocompromised, like the HIV patients, right? They do have the severe dandruff on the scalp because they are immunocompromised. They don't build up the immunity against the malaria fungi, and the dandruff gets improving. Generally, you will find that you will notice dandruff more in the case of men compared to the female because of the, as earlier I have said, because of the androgens, right? But the one thing, we should not put oil on our hairs, on the scalp when we are suffering from the dandruff, because these malaria fungi are lipophilic, like they attract they like the oil. They grow in the media when they get oil. So if we are putting, they are growing fast. So we advise our patient that don't put oil whenever you are having dandruff, and repeated do your wash, shampoo on your scalp.
Okay. And while we talk about shampooing, especially in the case of dandruff, market is full of products that claims to be, 100% dandruff free, or it will make your scalp 100% or 99% dandruff free. And there are conditions which claims to really, good for your dandruff or dandruff prone scalp. Now, my question is what a common man should do. I mean, should he or she go and consult a dermatologist in case of dandruff? Because again, it's very common, or they can go for these products, which is easily available in the market.
No, again, I'll say no, big no, because see, we as a doctor, as a dermat, we even check the size of the dandruff plaques also. The normal dandruff ranges from 0.5 to 1.5 millimeter of the flags. They are fine, scaly, non-greasy, and snow-like, right? They are considered as a normal dandruff, and they are diffuse in a nature on the scalp. In that case, we give the antifungal kind of shampoo, lotion, gels, which are available in the market. But there are certain other conditions of the also scalp which may mimic you like a dandruff, and you are going to treat with this medicine and you will not get an improvement. Like the seborrheic dermatitis, other is the psoriasis. In seborrheic dermatitis, the scales are greasy, they are diffuse or patchy in the nature, they are yellowish in color, and patient will complain that छोटी-छोटी दानी-दानी जैसा हो जाता है, typical complaint of the patient. And the other area of the body is also affected, like the area behind your ears, like the nasolabial fold, this fold on the chest area, on the axilla, on the back. These kind of body parts are also affected in the seborrheic dermatitis. So the treatment part is different from the what I have mentioned earlier for the dandruff. Right. Another is the scalp psoriasis. In the psoriasis also, the size of the dandruff is more. It looks like a dandruff for the common man, but actually it is not dandruff. It is one kind of scalp condition. It is thick and it is adherent to that scalp, and it is patchy in nature. Whenever you are going to try to remove that scale, you will find the underlying base is red in color, and you may notice the pinpoint bleeding. You may have itching or you may not have itching as in dandruff, but there are some characteristic features that different diseases are having, right? So we have to examine that diseases, and we do examine the other body part which are likely to be involved with respective disease. Say, for example, for the fungal infection of the scalp. In that, you will find that there are scaling. Madam, scaling ही है तो हमने dandruff का treatment किया. But we do examine that which kind of fungi you are having for that scalp, and particular which medication is necessary for that kind of fungi, right? There are different variety of the scalp fungus also. And along with dandruff, for the fungal infection, you will see the breaking of your hair shaft, like hair is also break, because that fungi also affect the hair. Sometimes your hair get break at the level of the skin. Sometimes it may get break on the above the level of the skin. So it depends on the which kind of fungi you are infected. So these are the some small characteristic by which we can differentiate the simple dandruff to the different skin disease, and we give treatment accordingly. So please don't do medication yourself. Consult your doctor and get it treated properly. Otherwise, sometimes what happens, patients are coming after using 2, 3, 4 months. Irrational use of the medication leads to sensitivity to that medication. And then once we are going to give that medication, we don't get respond also. And sometimes patients are also coming with us applying steroids. They feel that steroids is the one for the every treatment. And they end up with so many other complications. So please don't do this, because nowadays we are facing lots of this kind of patient.
Right. Don't abuse your scalp. Don't abuse your hair. They are your, part of your body, part of your identity. Don't ruin it by yourself. Please go and consult a doctor. We have so many good qualified doctors, dermatologists, and please go and seek help from them. Doctor, one more thing. We also wanted to talk about home remedies that people do. You said, many a times people apply onion juice, etc., and they end up burning their scalp. Now, how good or bad? Because with hair, everybody do so much at their home. They'll apply henna, they'll apply, other things on their hair. You said eating is good, but many people say that, don't eat, but it's more important to apply it on your hair or your scalp. So again, how good or bad can home remedies be for our hair?
See, I would prefer eating is very much important, because it is a formation of the hair. It is about the layman language. We can see कि अगर आपकी factory अच्छी है, production अच्छा ही होगा. When there is a defect in factory, कई बार production अच्छा होगा, कई बार नहीं होगा. So you don't have any guarantee, right? Like, so eating is really very much important. For eating, we should eat the proper balanced diet. There is no any other option for that. If you want the good luster, full shiny hair, you should eat protein-rich diet, green leafy vegetables, fruits, and proper amount of the balanced diet, right? For some kind of home remedies you can use, but don't use that acidic medium remedies like onion juice, garlic juice. They all have the acid. They are going to burn your skin. Use the light. You can use aloe vera gel sometimes. You can do some kind of a curd, mild curd, and just wash it. You can use mild henna. You can use honey also. But don't keep on applying one by another. Otherwise, you are just damaging. Normal, simple way you can apply oil. Coconut oil will also do. Don't use different brands of oil also. Okay. Right? And just wash your hand. आप जितना जेंटल रहोगे बालों के लिए, उतना ही वो अच्छे रहेंगे. बस the only thing कि आपको प्रॉपर उसका ध्यान रखना है, और बार बार अलग अलग शैम्पूज, अलग अलग कंडीशनर, अलग अलग होम रेमेडीज. Don't keep on changing each and everything, and don't do overuse of the cosmetic treatment, which is nowadays going in the market very much.
Yes. कुछ व्यूअर्स के क्वेश्चंस भी हम ले लेंगे. हमारे साथ शिवम वर्मा पूछ रहे हैं, आर देयर एनी पर्टिकुलर हेयर केयर प्रैक्टिसेस दैट मे इन्फ्लुएंस द हेयर लॉस or that may restrict the hair loss? It should be, I mean, in simple words, any important tips for healthy hair or a simple hair care regime that we can follow?
Simple tips for the hair care is, depending on your body and your schedule, you just follow the balanced diet. You follow sleep pattern, proper sleep. Important is the lifestyle management in a one way, I can say. Proper sleep, stressless condition, proper diet. And one more thing I just want to see, nowadays all are having the IQ, very much people are having good amount of IQ, right? But the EQ, which is emotional quotient, is very less. And because of less EQ or emotional quotient, they are very short tempered. They get angry very much. And because of angriness, they are releasing stress hormone, which is not good for the hair also. For all the organ of the body, they are not good for the head. So just improve your emotional quotient. Do regular exercise. After doing exercise, you release the happy hormone in your body, which are going to decrease your stress, and ultimately all the organs of the body, including hair, are going to work really very nice. Eat plenty of fluid in summer, especially water intake. So do all this. These are very small, and we all are aware of this. So at least follow the basic steps rather than going outside in the chemist and taking one and another shampoos and another conditioner and another hair colors or some cosmetic treatment. I generally don't prefer to go. But still nowadays all are going, but at least do somewhere minimum criteria. Don't overuse.
Right. Be gentle with your hairs. That's what's the bottom line. And doctor, as you also mentioned, there are people, and many a number of people are going these days for salon treatments like rebounding or firming or keratin treatment, which involves a lot of chemicals. Now, if we are going for that, or colors again is very common these days to, rectify their gray hairs. Now, what precautions we can follow, to take care of our hair, even if we are going for these treatments, or how good or bad these treatments can be for our hair?
See, ideally, I would not say that you should not go, क्योंकि मैं बोलूँगी तो भी सब जाने ही वाले हैं. It's not like, because nobody is having the virgin hair right now.
Exactly.
Everybody are doing color or some kind of one or another cosmetic treatment on the hair, in skin. But इतना देखो कि इतना ज्यादा color use मत करो. आप पहले आपके सलून से discuss करो कि after doing treatment, my hair should not be get damaged. Because what happens, they become very over enthusiastic and they just keep on applying proper chemicals on your hair, and they just keep on applying and keep it for the 1 hour, 2 hour, and finally what happens scientifically, they are going to damage your outer layer of your hair, and they are going to damage your cuticles. So your hair become very much dry, chapped, damaged, frizzy, and unmanageable. So after that also proper use of the gentle care shampoos, conditioner, and you can apply the serum also. And just don't do on the one and another day. कि आज party है तो आज rebonding करवाया, आज है तो ये करवाया. At least be gentle. If you are doing at home also blow dryer, उसको थोड़ा slow motion पे रखो. And after washing your hair, do after half an hour. So at least let it to be air dry also.
Exactly. So again, you need to be gentle with your hair. And doctor, before we wind up this session, any take home message for our viewers?
See, the first same thing, अच्छे से खाना खाओ, happy रहो, automatic आपके बाल अच्छे ही होंगे. You don't have to go here and there. And still after that, still you have any problem, please, 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 we are here to help you. All over the India, we are having our association. Please take a help of any of our colleagues and get your hair checked and treat accordingly.
Right. So whatever time, energy, money you are, utilizing in going to a chemist or buying over-the-counter supplements or products or medicines, etc., or surfing in the net or finding an influencer and following the influencer, again ending up buying few more products and applying them on your hair or skin. Rather than that, please save your money, save your energy, save your, everything, and save your hair as well by going to the right person. That's a qualified dermatologist in this case. Thank you so very much, Dr. Payal Choksi, for your valuable guidance and advice on how to keep our hair healthy, especially in the current scenario where, apart from the other environmental and genetic factors, the increased levels of pollution, stress, they are actually taking a toll on our hair health. Thank you so very much once again.
Thank you so much.
I'm sure your guidance will help our viewers, and viewers who want to get personal consultation from Dr. Payal Choksi, they can consult her at Prasanna Skin Laser Hair Care Clinic and Prasanna Hospital, first floor, Josh Point Complex, opposite Kshetrapal Hanuman Temple, Kailash Nagar, Madura Gate, Surat, Gujarat 395002. A big thank you to our viewers as well for watching the show, and for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved. Thank you. Have a great day ahead. Goodbye.
Thank you. Thank you so much.
Thank you, doctor.